And yes, so she's becoming a regular, right?
Feels like it.
Feels like a regular. Well, she's a regular to me, and that's Karina. Karina is our medical assistant, surgical assistant. What else do you do for us?
Pretty much everything.
Pretty much everything. That's right. And so Karina is just like is like Radar O'Reilly. So the youngsters, the Gen Zers, and I don't even think the millennials know about MASH. Do you know about MASH?
Yes.
You know about MASH. Do you remember Radar O'Reilly?
I appreciate that.
Okay, well, the Radar O'Reilly, that's what Karina is. So when I need something, I'm about to ask for it, it's there for me. So that's why we love having Karina here. And thank you for being with us today,
Thank you for
Karina.
having me back. Yes.
Thank you. Robin today, Robin always gets in touch with me every week and asks me, what are we going to cover? And today I thought what we would do is talk about what we can do without surgery, so non-surgical, to open up our eyes, to give us bright eyes. You and I have talked a lot about that, Robin.
Well, you always say the eyes have it.
Yes, and so, eyes are the windows to the soul. And Karina, so you've heard me talk about this with our patients, right? Of course. And we talk about their eyes being the window to the soul. So one of the first things, and it's not our topic for today, because we've talked about Botox and Dysport a lot in the past, but certainly that's one of the very first steps that we would recommend. And we usually inject Botox or Dysport in the 11s or in the frown area and in the side of the eyes, the crow's feet area, and that helps to open our eyes. And it's a wonderful treatment. And you can go back to our other shows and we'll, of course, talk about it in the future as well. Karina, I'm excited about the different treatments for eyes. And so what would you say that you've seen me be most excited about in terms of how we can help patients who want to have brighter eyes?
Specifically for under the eye, Easy Gel, our newest addition.
Our Easy PRF Gel.
PRF Gel, and then Renuva.
And Renuva, okay, so.
Why would I want that?
You want that, and so I think that we've talked about, let's talk about Renuva first, okay? And so, Robin, you and I have discussed this before. Renuva is actually what I call fat off the shelf, okay? So, kind of getting, I know we have Halloween coming up and then Christmas, and then it's the elf on the shelf, but we're talking about fat off the shelf, and that's what we're talking about. And so a lot of times if we look at our eyes as the windows to the soul, and you look at that, we talk about sort of the structures around our eyes as the window frame, okay? And so part of it is the top part of the frame tends to drop down as we age, okay? And gives us a heavy brow and can make us look tired, okay? And especially in all ethnicities that occurs, I'm a little bit more sensitive to that myself, just being Chinese and Greek, but with my Asian eyes and having the epicanthal folds and with the eyelids hanging down more, I'm always much more sensitive about keeping my eyebrows up as high as we can. So what I might ask you, Karina, is why do I like Renuva so much? How does that help us in terms of raising our eyebrows?
In terms of raising the eyebrows, I've seen you use it a lot in the temples to help open up the eyes and kind of recover some of that loss of volume that has been there. And then directly under the eyebrow as well to help with the lifting. I've seen you do it, that technique.
Right, so maybe we can...
counterintuitive in a way, right?
About injecting in there because you think it's going to make it heavier, but it actually lifts.
All right, thank you.
Yeah, okay, I'm glad you brought that up, Robin. So part of the aging process is we all get older, and it's great if you're on YouTube watching this show because we're posting this on YouTube each week when we have a guest like Karina. And all you got to do is look at Karina, our Gen Zer, and me as the aging baby boomer, and you can see, even though she has a tinier face, but you can see this nice layer of fat that keeps her looking youthful. And as we get older, we begin to lose volume in our face. And some of the areas, we tend to think of our cheeks losing volume, and then we see jowls are occurring. But we also lose it in our forehead. And if you were, I know it's our listening audience, and again, Robin, I always want to thank them, right? Aren't they great, our listening audience?
Yes.
Yes, we're so lucky to have them. And so and we really appreciate you listening every week to us on KSRO here on Ask the Expert. But if you'll notice as we get older that our foreheads begin to become bony. If you were to be watching us in studio now, and I know those listening to us can't see us on the radio, but you would see that even with Karina and her tinier face than me, she has just this really fine layer of fat in her forehead, and my forehead, it looks less full, if you will. And so because my forehead looks less full, what happens is my brows begin to drop down, and that's what Karina is talking about. So what we do is we use Renuva, and I call it fat off the shelf. Renuva is actually cadaver fat, and so it is fat that's harvested, and it is been through a tissue bank. So we use bone grafts all the time in medicine for health reasons. I have a bone graft in my jaw because I had some gum surgery with an oral surgeon, and so what they did is because of my bone erosion, he put in a bone graft in that area, so immediately it gives it some strength. But then what happens is that our body begins to eat away at that and lays down some fibrous tissue, which is good, collagen and scar tissue. But then my stem cells actually kick in and starts laying down my own bone cells in place of where the cadaver bone was placed.
Sounds like a twofer.
Yeah, it's really, so you're right, it's a 2-for-1, as Robin was just mentioning, where you get initial volume with just the injection of the placement of the bone graft, and then your body produces through your own stem cells, your own bone in that area, which is great. So it's the same concept with the fat. Karina hears me talking to the patients about that, because at first they kind of go, ooh, this is cadaver fat, that's something that I don't really think I want. And I explained to them about bone grafts, and many of them have had bone grafts, and they don't realize it's either cadaver bone graft or it actually comes from a pig. Okay, and modern medicine has really come a long way. It doesn't have any transmissible diseases. It's very safe. For those who may not remember, I was a kidney transplant surgeon, and so I used to harvest tissues and organs, livers and kidneys and so forth, for human transplant to help to give quality and extend life to people. But we can also take certain things like bone to improve our bone structure, or fat. So we use this fat, the Renuva.
It's nice to have that history, to know that we're safe doing this, because sometimes when you say these kinds of things, it's like, oh.
It's a little bit daunting when you think about that, but
daunting.
again, this is really in my wheelhouse with the world of transplant and stem cells. So that's what we do. So one of the things that Karina had mentioned was that I injected in the temple area and then just underneath the eyebrow. And what that does by revolumizing, Robin says it seems counterintuitive. I've been doing it so long, it seems very intuitive to me. But what happens is that when you inject volume in there, it actually lifts your eyebrow up, okay? And so that can make a big difference for patients, and it looks very natural.
Yes.
So it's like kind of like a facelift, not that much, but in that kind of vein of that part thinking.
Yes, more like a brow lift, but as you're saying, Robin, more like a surgical facelift, and not to that same degree, but it's more subtle, but it looks more natural in my opinion. And Karina, do you ever hear patients talking about their temple area? I mean, it doesn't come often, but sometimes when they really study their face, what do they mention about their temple area?
Right, they do say more bony, or it looks more, concave, but it's not an area that someone would look at and say, wow, I definitely need fat in there. So it requires a little bit more of Dr. Tom's eye to say, hey, what about this area you've never thought about?
Right, and we
don't know.
and exactly, Robin, that's this is what we study, this is what we're passionate about, and trying to help patients to feel more confident. That's why we do these things. And so one of the words that Karina mentioned was bony. We're kind of coming into Halloween time, but I've actually heard patients and ladies say, I feel like I look skeletal. I look like Skeletor, okay? And that's what they feel, that in the temple areas that they're pretty hollowed out. So one, aesthetically, that makes them look more frail. Okay, so just in terms of an impression of how you look when you present yourself, you look more frail, but also because of that lack of volume that we talk about, it drops the brow down. So,
so there's a couple of things going on that we need to be aware of.
Yes, and exactly, and that's why we spend so much time educating them. And I wanted Karina to be here because I wanted her to kind of describe the process of what we do for our patients. So Karina, when patient, I always like to use the name Natasha. Okay, so when Natasha comes in, and all you Natashas out there in Radio Land, hi. When Natasha comes in, and we're going to be using Renuva in the temple area to affect a brow lift. What's the process for Natasha? What do we do?
We always start by documenting. So photos. We want to take great photos, really showing the areas for before and after and comparing. And then we want to make this a comfortable procedure for them. So Dr. Tom does spend a little bit more time numbing with a little bit of local, which is how we do our surgery. So we do that. And then this is done under a sterile technique. So it is packaged in a syringe that is sterilized, double packaged. And Dr. Tom really spends a lot of time in prepping the face and prepping the skin and making it nice and clean to reduce, any chances of infection or anything like that.
Right. So I just to spend a little time on that. So we do use a sterile technique, and being a surgeon, sometimes if you're on Instagram and other social media and the reels and the videos, and you see them and they don't use that technique, I'm not saying what they do is wrong, but we just take that extra step for safety, and that's always important to me. And so because we're using the fat off the shelf, we want to make sure that this is done in a sterile fashion. Now it is a little bit thicker, and so when we use like Restylane or Juvederm, it's soft and clear and a little more runny. What does the Renuva look like to you when we inject it? To me,
it's a little bit more of a toothpaste consistency.
Right. I would agree.
Dr. Tom does use a little bit of dilution with lidocaine and a little bit of saline water.
So we mix that up, and then we do the injection under local anesthesia, right? And I have to say that I really love this technique. And in fact, Robin, I'm presenting this at the not the American, but the California Academy of Cosmetic Surgery annual meeting, first week of November in San Diego. So I'm very excited about presenting our work there. And so
you haven't been out of the circuit for a while because of COVID.
Because of COVID, and we're
really excited.
I really enjoy meeting with my colleagues at these meetings. Even though I'm presenting, I probably learn more than I'm teaching, and that's always great.
Let me just give you this. Mary, his lead nurse, says he's the Mick Jagger on the circuit.
I wish I was, but that's very.
I think he's being a little humble, but okay, I'm glad you're back out there, Jagger.
Thank you. I appreciate that. So that's Renuva for a what I'm going to say, a brow lift, in the temple and the upper eyebrow area to lift up and open up our eyes more.
And that's for you have either your fat or the Renuva, right?
That's correct. So Robin mentioned your own fat, and that's fat graft, what I would call autologous, which means your own fat grafting. And Robin and I have discussed this for years, Robin. It's been one of my passions.
It's a 6 1/2 dozen in the other, as my grandpa would say.
Well, the difference is that with the fat grafting is that it is a procedure under local where we do have to harvest fat. So it's like a little mini lipo procedure to remove your own fat to use. It's the best fat, but a lot of our patients come in, they're actually too thin. They don't actually have fat.
I like them already.
It's too funny though, but it's true. So you get especially these very slender people, and so they don't have fat, and it actually accentuates that fat loss in the forehead, and so their brow can even drop more. And they actually, although we tend to think, when you talk about body physiques and all, the thinner person, when they're younger, and maybe that's something that they like. When they get older, the concern is they begin to look more fragile, and where they begin to look fragile a lot of times is in the face. So Renuva or your own fat is a great way to treat that.
Thank you for the option.
Right. Yeah, and then Robin, as we were talking, and you asked me about what else can we do for the eyes, and sort of not surgically, is to work at we talked about the top of the frame of the window seal of the frame, but looking at the window seal or the bottom portion, and that's under our eyes. And so a lot of patients come in, Karina, right? We see them, and they're complaining about under their eyes. They feel like they look hollowed out, and they will come in specifically. Not too many come in and say, oh, my temples need to be filled, but they do say, under my eyes, you know, they look hollowed out. And so we have a treatment that we've been now doing for the last couple of years that I love, and that's
Easy PRF Gel.
Come on. It sounds great. Easy PRF, I mean, is it you know, it just go to your place, in and out, like a lunchtime thing?
It's something that can be done. We spend about an hour and a half, and I'm going to let Karina describe that for you, but let me just explain what Easy PRF Gel is. So Robin, you and I have talked about PRP, or platelet-rich plasma, and that's where we do a blood draw, we spin it down in a centrifuge, and we take the serum, which is high in platelets. And it's not just the platelets, which helps with blood clotting, but it's all of what I call the paramedics of the body, Robin, and that's the different healing factors. It's not a stem cell transplant, but what it does is it stimulates along that same biological cascade, if you will, of stem cells. And what it does is it can help heal. And so we would take PRP and we would inject it under the eyes. And the skin looked better, but we didn't get much volume effect. So what we then found as we went through a few permutations is that they activated the PRP that became PRF, which is
platelet-rich fibrin.
Platelet-rich fibrin. Thank you. Karina knows so much. I know. I love it. She's so smart. Platelet-rich fibrin. And so we would inject it under the eyes. And I could see a little bit of volume effect, but it was more for my trained cosmetic surgeon's eye. Maybe the patients didn't notice it as much. So I didn't get too excited about that, because you really want the patients to see the difference, not just me see the difference. And so then along came Easy PRF Gel, which I'm going to let Karina tell you. We have about 10 minutes here, Karina. So why don't you tell us, when Natasha's sister comes in, Svetlana, and so Svetlana comes in and she says, oh, under my eyes are hollow. What do we do for her?
We would most likely recommend the Easy PRF Gel. We document with photos, and if they're doing the procedure the same day or we book it ahead of time, that would be great. But we're essentially doing a blood draw. So we're doing a blood draw into 2 tubes. So it's not a good amount of blood, but just enough for us to do what we need to do. And the system comes with a centrifuge, so a spinner, and a heater and a cooler. So it's a 3-component system. One of the two, then they're color coordinated. So red is warm and blue is cold. And once the tubes are drawn, we spin the red down first, and we remove the albumin, or the liquid gold is what we like to call it, liquid gold.
So what Karina is just a little further just description. So she's heating up one of the tubes, okay, and it's the
albumin.
That's the albumin, and so
Liquid
albumin.
gold.
So what she's doing is we're taking the serum in this particular test tube, and we're converting it from a liquid form to a gel form. So it becomes a gel. That's why you hear the phrase Easy PRF Gel. And what it's doing is we're going to be extracting the protein out of the serum. And that serum, that protein that we're extracting is what Karina is mentioning is albumin. And so we always have to ask Michelle, where else do we see albumin?
Well, we see that's the white of an egg.
That's right, in the egg, in the egg white, exactly. And so, and you see that kind of gel type of effect when you start to heat it up, right? So we're gonna take that protein of the albumin out of that one tube, and what does the red tube have?
The red in the tube.
The Easy PRF Gel system. That's the PRF.
That's the blue is the PRF. Yes.
So what we're going to be doing is we're taking the PRF then that we described earlier, and we're mixing the PRF with the gel, the protein gel. So you're having, and it's called Easy PRF Gel. And what we're getting now is a semi-solid or gel-like protein mixture. And we usually end up with about 4 syringes from these draws, and then
Seemingly a lot.
it's a
It's a
fair
good
amount of
amount,
volume, right? It is. And so then what do we do with that after once we get that?
We'll mix it together, so you'll mix your PRF with your albumin as a gel form. It stays as a gel form, and then Dr. Tom will numb the area for an entry point, and then inject with a cannula under the eye.
So what we do, exactly what Karina is describing, is we'll again use local anesthesia. I'm the president of the Weenie Club, right, Robin? But I'm an empathetic weenie, so I always want to make sure things are very comfortable for our patients. So what we do is we freeze up the skin, and then we take a tiny little cannula, which looks like a needle, but it's blunt on the tip, and we slowly go underneath the eyes, and we layer down your own PRF protein, or the Easy PRF gel. And so what happens is that albumin is holding your PRF, and so you do get a release of PRF initially, but because that PRF is incorporated within the gel, it's also releasing it over days versus just a one shot and you get the whole bolus and then it goes away. So it's releasing the PRF slowly from the gel, and you also get some volume from the gel itself.
So you get an initial hit and then a graduated kind of increase.
Correct, of the PRF is being released, plus you get the volume effect of the gel. Now, what I need to explain is that this is not going to it's going to completely erase everything, okay? So we're talking about...
Everybody wants everything yesterday.
Right, and it takes incremental improvements, and it does take multiple treatments. Usually you have treatment number 1, and then we have you come in within, just usually because of our scheduling, within a couple of months' time, and we do a secondary injection. And if you're happy with that treatment, then it's something that you would probably do just 1 treatment annually, okay? Again, it depends on how hollowed out your eyes are. For as much as my brow drops and I need the Renuva, and I'm going to have Mary inject that for me to give me a little bit of a brow lift, my under eyes are not as bad. I still have some under eye hollowing because I'm an aging baby boomer, but probably I will be able to have just what Karina and I were describing, the Easy PRF gel, just do 2 sessions and then probably have a session once annually.
Can I ask Dr. Tom,
Sure.
with this sort of volume that you get, because it's in this sort of gel form, how long do you have that initial volume? Because does it last, or does it sort of deflate a little bit as it gets absorbed into the body?
So Karina, what do you think the patients experience when they first have that? Do they look swollen at all?
I would say that there is a significant swelling for the patient for, I would say, maybe 2 to 3 days, just depending on how reactive they are. And then it does settle down to a nice volume that they want. So it's kind of like, oh, it's too much, just too swollen, to, oh, I don't want it to go away.
Right. And then they begin to wonder, geez, am I losing the volume? Is this really working for me, right? So interesting, it always happens, Robin, that when you ask me about a topic, a patient walks in with sort of an issue with the topic that we're discussing today. So we just have a lovely young lady that I've known for many years, and I always think of her being in her 20s, and now she's a Gen Xer, so she's older now, and we have done treatments under her eyes. We actually had to do 3 treatments over probably an 8-month period of time. And she was asking me, lovely lady, and she asked me, can we see my before photos, because I want to see if I see any improvement, okay? And very reasonable request. And so what I did was, after we were doing another treatment, I think we were doing maybe Dysport for her or Botox for her, but I went back and I pulled out my little iPad camera and I pulled it up and I went back to the time frame right before we did her first session. And we looked at it together, and she said, oh my gosh, there absolutely is a difference, okay? That my eyes look better, that underneath my eyes, they're still a little hollowed. I'd like to be more volume there, but it's definitely an improvement than what I had some 8 months ago.
Right.
And do you remember, Karina, the one comment that she made when she looked at her face from 8 months ago?
Well, I do know that she had some weight loss in between that time.
Exactly.
So she looked even, the results held on even after her weight loss.
Right. So really, that's important. That's huge. I love that you... One thing that I'm really proud of our team is that we listen to our patients, and that's really important. We talk about that all the time. You got to listen to the patients. And this patient of ours relayed to me that she noticed that her face looked thinner and that she had lost 20 pounds over this 8-month period of time. So the results under her eyes would actually have been even better. So it was even more impressive to me that here she is 8 months later with an 8-pound weight loss, and she had improved volume underneath her eyes, where she would have even looked more hollowed out. So that's easy PRF gel for under the eyes to have bright eyes.